Hi, you guys. Welcome back for our daily practice questions. It is day 237, and as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q-banks, one-on-one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any other questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. But before we get started, don't forget to hit the subscribe button so you're not missing any of my videos. And if you would like to gain access to my NP Test Success Toolkit, it is free and linked in the description. My website is also linked in the description and houses all of the resources that I do offer. I also like to always mention that if you're just looking for a one-stop location of my business profile, simply go to Google and search The Nursing Studio, and it will take you directly here. That shows the telephone number that you can call or text, the link to my website, as well as testimonials from previous review students. All right, y'all, let's get into the questions for today. Question number one states, a 65-year-old African-American man with hypertension presents for a routine eye exam. He reports gradual loss of peripheral vision, but denies any pain or redness. Fundoscopy reveals cupping of the optic disc. Which of the following is the most likely diagnosis? Is it A, open angle glaucoma? Is it B, angle closure glaucoma? Is it C, central retinal artery occlusion? Or is it D, diabetic retinopathy? Take a moment and tell me what you got in the comments, y'all. All right, so y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you, right? So here the stem of the question states, which of the following is the most likely diagnosis? And what do I always say? If they're looking for a diagnosis, you got to run it back and look at the assessment findings. And when looking at these assessment findings, I always tell you don't skim across these things. Make sure you're paying attention to if they are provided the age, the gender, and the ethnicity, as this can help you with the diagnosis as well as treatment. So we have a 65-year-old African American male who has a history of hypertension presenting for a routine eye exam. He reports gradual loss of peripheral vision, but denies any pain or redness. The fundoscopy reveals cupping of the optic disc. All right, that cupping is classic for glaucoma. So now you need to be able to determine what type of glaucoma, right? And with this gradual progression of changes of vision, this is your open angle glaucoma. Okay, open angle glaucoma. Remember, let's do question two, and then I will explain in detail how to break this down on open angle glaucoma, right? But remember, the eyes are still open. There's gradual loss here, okay? Question number two. A 58-year-old woman presents to the emergency department with sudden onset severe right eye pain, headache, nausea, and blurred vision with halos around lights. Exam reveals a mid-dilated fixed pupil, conjunctival injection, and the intraocular pressure is 45. What is the most likely diagnosis? Is it A, angle closure glaucoma? Is it B, open angle glaucoma? Is it C, optic neuritis? Or is it D, retinal detachment? Take a moment and tell me what you got, y'all. All right, so stem of the question here states, what is the most likely diagnosis? And again, that means we got to run it back and look at our assessment findings, right? So we have a 58-year-old female comes into the ER with complaints of sudden onset severe right eye pain, headache, nausea, and blurred vision with halos around the light. Y'all, this right here is all you need. That presentation alone should tell you right there, angle closure glaucoma, right? Now, the extra details of the mid-dilated fixed pupil, intraocular pressure of 45, I added all of this in because this is what they'll do on boards. Knowing that this is not all of the details that we really look into, but these are things that are provided that will have you down the rabbit hole, and you need to you need to know what to focus in on. So here, this person has sudden onset severe right eye pain, headache, nausea, blurred vision, halos. All right. So look at open angle versus closed angle or angle closure glaucoma. And Brittany's brilliance, the way I tell you to think about this is, you saw on question 1, there was gradual vision changes, right? The eyes are still open angle. That's how I say to think of it. Your eyes are still open. There are gradual changes. Whereas with angle closure, this is emergent. Open angle, we do beta blocker eye drops to kind of help aid with this. Angle closure is emergent. It's rapid. There's sudden changes. It's painful. They can have the headache, the nausea, the halos, the blurred vision. But I always say it's emergent. You don't want the eyes to close with angle closure, meaning you don't want them to go blind, because that's what's going to happen if we don't have this resolved in an emergent fashion. So for our FMPs, refer out immediately to the ER for emergency management. So open angle, the eyes are still open. It's gradual vision changes. Angle closure, the eyes are trying to close suddenly. It's emergent. So we don't want them to close. We don't want them to go blind. So angle closure is your emergent sudden one. All right. Lastly, question number 3. A 23-year-old woman presents for evaluation of a heart murmur. On auscultation, there is a mid-systolic click followed by a late systolic murmur, best heard at the cardiac apex, which increases in intensity when standing. Which of the following is the most likely diagnosis? Is it A, mitral valve prolapse? Is it B, aortic stenosis? Is it C, mitral regurgitation? Or is it D, hypertrophic cardiomyopathy? Take a moment and tell me what you got. All right, stem of the question states, which of the following is the most likely diagnosis? So again, let's run it back and look at the assessment findings. So we have a 23-year-old female presents for evaluation of a heart murmur. On auscultation, there's a mid-systolic click followed by a late systolic murmur, best heard at the cardiac apex. It increases in intensity when standing. All right, y'all. So y'all know I always talk to y'all about murmurs and how to approach it. I'll tell you they can give you all these things, and although the information is pertinent, when you're trying to answer a diagnosis question on murmurs, look to determine whether it's systolic versus diastolic and where it's located, and you will be able to answer these questions every time, okay? Now, I did this question on purpose because I teach this method, so I wanted to make sure that you knew this as well if you ran into this, okay? So, systolic versus diastolic. I give you my Brittany's brilliance for systolic. So you can know systolic versus diastolic. Systolic, I call it sassy systolic. I revamped it so it's not hurting anybody's feelings, but I say men really are silly. So men really, MR, mitral regurg, right? Are silly, AS, aortic stenosis. And then MVP also falls into this category. Now, diastolic is the opposite. Also, location-wise, remember, aortic location is at the second intercostal space, or it may also say the base of the heart, right? Mitral is at the fifth intercostal space, or it may say at the apex of the heart, right? So you're going to know systolic versus diastolic and mitral versus aortic, right? So you can determine the answer. Now, for a scenario like this, so we have a systolic murmur. So we know it has to be mitral regurg, men really, or aortic stenosis, or silly, or also that little outlier, MVP, your mitral valve prolapse, right? Now, the location. This says best heard at the apex of the heart, right? What did I just say? Apex is mitral. So now we know it's down to mitral regurg or mitral valve prolapse, right? The reason and the key identifier for you to know that this is mitral valve prolapse is the mid-systolic click. When you see click, know MVP, okay? So I wanted to throw it to you in this fashion so that you can know, if you have to narrow it down from this perspective, how to approach it, okay? And if you struggle with murmurs, go to my playlist, scroll down to the murmur section, and watch my videos where we walk through. I talk you through all of it, give you my Brittany's Brilliance mnemonics, and walk you through questions so that you can have a variety of scenarios to process through. But I wanted to make sure you knew this one. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the nursing studio. You can give us a call, shoot us a text message, shoot us an email. And as always mentioned, my website is also linked in the bio of this channel as well as in the description of this video. All right, y'all. Y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.